Thank you, Mr. President. Time is running out for us to extend the Children's Health Insurance Program that began 20 years ago, almost, in this body and the other body, that is taking care right now of 10 million children, the children of parents, of mothers and fathers who in most cases have full-time jobs that don't offer insurance and full-time jobs which don't pay enough that these families can buy insurance for their children. We know that CHIP works. It works for parents, it works for children. We know if we don't act now, states will start rolling back their CHIP programs. Legislatures are adjourning almost as we speak. We need to provide states certainty so they can budget for CHIP now and 4 years into the future. Unfortunately, the deal currently being floated in the House would not fund CHIP for a full 4 years. Instead, if reports are true, it would permanently repeal the sustainable growth rate, the so-called doctor's fix, while failing to provide much-needed certainty to children's health care. So I want to take care of the doctors. I want to make sure this is done right because it affects doctors. It affects doctors' ability to deliver care. It affects those patients whom doctors serve. But how do we leave here taking care of the doctors permanently and shortchanging children, only giving them 2 years of health insurance? It's past time we fix SGR. In fact, in 2001, when I was a member of the House, Congressman Bill Arakis, the Republican chair of the Health Subcommittee, the Energy and Commerce Committee, and I, his ranking member, the Democratic ranking member on the Energy and Commerce Health Subcommittee, we wrote the first SGR fix in 2001. So I've been doing this a long time, fixing SGR, but we shouldn't be focused in this body and that body on paying doctors at the cost of shortchanging our children. Our priority must be passing a full 4-year clean extension of the current CHIP program on which 130,000 children in my state depend. Again, sons and daughters of working Oklahoma families, working Ohio families, working in jobs where they simply don't get insurance and don't get paid enough that they can buy insurance. These 10 million children in our nation depend on this. A 4-year extension of CHIP will provide Congress, the administration, and our states with the necessary time to collect relevant data and information to fully analyze and prepare for the future of kids covered. So it's not just shortchanging these children and creating anxiety in their families by only doing 2 years. It's also truncating our ability, compromising our ability to really understand how to fully integrate CHIP into a healthcare system overall in the future. We should be providing certainty and stability to these families, not the cliche of kicking the can down the road in favor of a short-term fix. A 4-year extension provides that certainty and will make a difference into the next decade on how, in fact, we take care of low-income children. In Ohio alone, CHIP, as I said, provides insurance to 130,000 children. Enrollment's expected to grow over the next couple of years. I've traveled across Ohio just in the last few weeks, meeting with parents and children, doctors and nurses to discuss CHIP. I've been at Cincinnati Children's, at Toledo Children's Hospital, Columbus Nationwide Children, and at Cleveland's Rainbow Children this morning. I was in the Mahoning Valley in Boardman, a suburb of Youngstown, at the Youngstown campus, the Mahoning Valley campus of Akron Children's Hospital. 6,000 children in the Mahoning Valley rely on CHIP for care. I met with Eric Flaherty, a Youngstown parent whose children could lose comprehensive coverage if we don't extend CHIP now. Her son Chase was born prematurely, born at 27 weeks. He was immediately diagnosed with a number of chronic conditions: heart defect, chronic lung disease, he has asthma. Chase spent more than 4 months in neonatal care. Thanks to outstanding doctors at Akron Children's, he's alive and growing today. But he needs many routine medical visits that his family simply can't afford. Her parents work, but they simply can't afford to treat the conditions, the visits to lung specialists and neurology and eye specialists, and simply the regular hospital checkups every 2 months. Without CHIP, Erica would face significant financial hurdles in getting Chase the care he needs. I also met with Jessica Miller of Lisbon, a county in a community just south of Mahoning County during this roundtable. Her youngest son, Peyton, was diagnosed with a serious respiratory condition. He had to be life-flighted to Akron Children's to receive care when he couldn't breathe. He's been diagnosed with type 1 juvenile diabetes. She told me, his mother, Jessica, told me, and his grandmother joined us, she's so thankful for CHIP so that she got Peyton all the care he needs to treat those conditions, care that she and her husband, Justin, would have a hard time affording otherwise. Justin is working as a paramedic. He was called out and couldn't be at our meeting today. Justin is full-time in nursing school. They are making something of their lives. I don't want them to be anxious about the health care of their children. Throughout Ohio, I hear the same thing. Providing health insurance to children like Chase and Peyton isn't just the right thing to do, it's the smart thing to do. It means children do better in school. They feel better when they're at school. They miss fewer days of school because they get preventive care because their insurance, their health care needs are taken care of. We also know statistics show when you follow these children that are part of CHIP, remember it's 20 years of, it's been around 18 years, almost 20 years. It's always been bipartisan. If you follow these children later in life, you see that they have higher rates of going to college, higher earnings than non-CHIP kids who don't have insurance. By all kinds of very quantifiable measurements, CHIP is not just good for those families, not just the right thing to do to continue to fund CHIP over 4 years. It's also the smart thing to do with our country. Together with my colleagues, more than 40 of us, I introduced the Protecting and Retaining Our Children's Health Insurance Program, PRO-CHIP, which is a clean 4-year extension of funding for CHIP. PRO-CHIP would protect the Pediatric Quality Measures Program, provide funding to sustain this through 2019. It would extend the Performance Incentive Program, which provides bonus payments to states that help increase Medicaid enrollment among children. Because if you provide insurance for these children, for low-income children, they're going to do better, society's going to do better. They're less likely to end up in the emergency room for something much more serious. For instance, a child without insurance who has an earache, and the mother and father think, it's going to cost a lot of money to go to the doctor, maybe this will just get better. They wait a week, into the second week, the pain is worse, the child can't sleep, the child cries. They eventually go to the emergency room, costing a lot more money than going to the doctor's office, with the the possibility that child has had hearing loss. I mean, that's just one example of why you want to provide insurance and get them into the doctor early rather than waiting late. PRO-CHIP has been endorsed by every children's hospital in Ohio, almost the Association of Children's Hospitals, virtually every children's hospital, I believe, in the country, other national groups, March of Dimes, the American Academy of Pediatrics, the Children's Hospital Association, Families USA. All of them want a clean CHIP. All of them want a 4-year extension for all the reasons we talked about. 1,500 organizations across the country, 75 from Ohio, a number in Oklahoma, the presiding officer state, have written to Congress asking us, quote, to take action as soon as possible to provide a 4-year funding extension for CHIP. Groups including the Urban Institute, the Medicaid and CHIP Payment and Access Commission, the Bipartisan Policy Center have all noted the importance of the current CHIP program. The Urban Institute estimated an additional 1.1 million children would become uninsured if separate CHIP coverage were eliminated. Again, these are sons and daughters of families who have jobs, parents who have jobs that don't provide insurance, and jobs that don't pay enough that they can afford insurance. This would be a 40% increase, if this would happen, in the number of uninsured children in the United States relative to the number projected under the ACA with the continuation of CHIP. The Bipartisan Policy Center has called for extending CHIP for more than just the 2 years. But note what they say when calling for CHIP extension. Quote, 2 years does not provide sufficient time for state and federal elected officials and agencies to address the major programmatic change sought by policymakers on both sides of the aisle at both levels of government. That's the Bipartisan Policy Center. Support for CHIP's always been bipartisan. Senator Hatch, Republican, Utah, Senator Kennedy, Democrat from Massachusetts, a number of us on the Energy and Commerce Committee in the House of Representatives. Back in 1997, Republicans and Democrats alike, Chairman Bilirakis and I and others, helped to write this legislation, which has been successful at bringing the uninsured rate for children bringing it down by more than 50%. I'm encouraged that members of both parties have shown a willingness to come together. Senate Democrats, Mr. President, will have a hard time supporting any plan that doesn't extend CHIP for a full 4 years. I want to support the sustainable growth rate. I helped write the original one. I've supported it for 20 years. We shouldn't be doing it like this on a temporary 1 or 2 year basis. This is finally going to get done right, but you don't do that and then leave out the children by only providing 2 years. Parents like Eric and Jessica face enough uncertainty with their children's health. Many of us in this body, or most of us in this body, are parents. A number of us are grandparents. Most of us, because we dress like this and we're United States senators and have good insurance provided by taxpayers, most of us don't have we may have anxiety about our children and grandchildren's health, but we don't have anxiety about their insurance and their ability to go to hospitals and go to doctors and go to specialists to get care. Certainly we're anxious about our children and all the things that can happen, but our anxiety doesn't stretch or reach into the whole sphere of worrying about how do you provide insurance for children. Erica and Jessica, their anxiety, they can't be anything but anxious when they hear that CHIP could end, and they understand that it should be 4 years. CHIP gives parents like them peace of mind that they'll be able to get their children the care they need without bankrupting those families. We need to make sure these parents continue to have that peace of mind. A 4-year extension, the legislation, the pro-CHIP legislation we've introduced in the Senate with almost 4 dozen co-sponsors. We have to make sure those kids don't lose critical coverage by saying no to any deal that doesn't fund CHIP for the full 4 years. Thank the presiding officer.